So, for those of you who don't know Dr. Margo Roman, she is an absolute pioneer in veterinary ozone therapy and MBRT, microbiome restorative therapy, as well as many other things that we're not going to get into. But those are two that she's very well known for. So that's really, really neat about her. She's an acclaimed international speaker. She's been all over the world speaking on these things and other things regarding veterinary medicine. She's the founder of Main Street Animal Services of Hopkinton, affectionately known as MASH. And she's the author, or co-author, I should say, of A Healer in Every Home. And so when I think of Dr. Roman, there's three things I'm going to put out here for her as far as her character. And the things that came to mind for me are she is determined. She's going to go after what she thinks needs to be done, and she's going to do it with everything she has. She's committed. When she knows what she believes the right thing is to do, she commits to it, and she moves forward undeterred. And she's a great collaborator. She is always trying to help people, organizations, veterinarians to work together and to bring people together in a way that would make everybody else stronger. And there's a lot of things I could say about her. Those three things, though, stood out for me. And so I just want to thank Dr. Roman for being here, for being who she is, for being true to that, and for being so willing to share so many important things with the people around her, whether they be peers or coworkers or people like us who just need help from a veterinarian. So with no further ado, I'm going to turn it over to you.
When we started doing Ozone and really working, when I was getting so excited about it because I was seeing such major changes in my own horse, who Tufts had told me that he would be dead in 2 days. And he lived a total of 8.5 years with cancer that usually kills him in 1.5 years. And I can get his whole story, but the university said he would be dead in 2 days, and he lived 2.5 more years. And I put him down at 28.5. And he was jumping in horse shows and he was doing stuff. And it was like, I wasn't going to give up on him. And what can I do? And I always want to give people credit that lifted me up, and Judah Shoemaker and Tina Aiken. They said, do Ozone. And nobody knew how to really do the kind of ozone that I know now. But I thought, well, let's do it. And when he survived, it was so amazing that I tried it on my patients. And it was so amazing that I tried it on more patients, and I kept getting all these different results. And so to encourage the pet owner to have these tools in their home is what I try to do for my clients. So if they can do it themselves, why not? Why not support their immune system? And knowing how to use the ozone generator and being able to use it is something that I think is that I personally believe that everybody should have one in their house, whether if they just want to disinfect their vegetables because they got exposed to some bacteria and they want to make some ozone water, or they want to do, insufflation for their dog, or they can learn how to do it for humans and do it on their family members. It's a wonderful modality, but I think it totally also potentiates veterinary cases. And wherever we can get more oxygen into the body, why wouldn't we want more oxygen in the body to help us heal? So it enhances oxygen and mitochondrial response. And so it's good for pretty much everything. I include ozone on pretty much, I would think probably 90% of my cases will get ozone. So a little bit about my background and my studies. And, I feel like I'm a perpetual student. I just keep studying, and the more I know, the less I know. And when I find something that really is effective, I want to share it and teach it. And so I do a lot of lecturing and speaking. And I enjoy it because it's exciting when somebody learns about doing some of this stuff and then does it, then they teach me something back. That's really exciting. And that's something that Jonathan has done, is he knew a little bit about ozone, but he jumped in all, I want to say all four paws, but he doesn't have four paws, but jumped in and really wanted to explore this thing and build a connection of pet owners and veterinarians and trying to educate us all so that we could move this phenomenal medical treatment to a much higher level. And it's being done that way. And as we get more doctors doing it and they're experimenting, on their patients and finding the successes, they go on. And in 2021, the American Holistic Veterinary Medical Association, which I encourage everybody to look there for veterinarians that have done that are doing ozone therapies and other therapies, that I got awarded the Holistic Vet of the Year in 2021. So here are my donors, and the reason why I combine the microbiome restorative therapy with the ozone is these are my dogs. They're 30 years of generations of 6 to 7 generations. I have another generation, but 6 strict generations that have been raised never on antibiotics, only treated with homeopathy and herbs and acupuncture, on organic, fresh food. And we live on 7 acres that is virgin woods that has never had any chemicals on it. This is my clinic, MASH in Hopkinton. And those of you that are in this area can take advantage of that. Otherwise, I'm willing to consult to your vet. And they're the vet on the ground, and they can get the background that we have. This is the clinic, and on the lower level, which is in the top picture with the benches in front, that is our whole microbiome center now, and we are shipping poop all over. And I'll give you the references for that. We built the building green and sustainable and feng shuied when I did it back in 2001, and we've continued to do all the additional pieces that way too as well. But as a pet parent and pet caretaker, using ozone during stressful times is wonderful. When your animal is having a problem, if you can just step up and do that right away, I think you can increase the chances of your animal having a better outcome. The benefit of ozone to increase oxygen utilization and increase mitochondrial function is a win-win for the patient. Working with your vet, you can continue to give support in this area that the pet needs. Encouraging your vet to take a class in ozone, to incorporate it into their practice. And the ones that do go, oh my God, how did I survive without ozone? But there's a wall that sometimes go up, and they think ozone is something that's going to kill them because it's what they measure, when they have toxic material. And I'm pretty sure you guys have already gone through that on why people have a misconception about what ozone is. With infections, we must be judicious with antibiotics. And the AVMA came out in 2020 that we must have a different way of approaching infection without antibiotics, because 700,000 humans die each year from antibiotic resistance. And ozone is such a wonderful treatment. Adding the ultraviolet light therapies, whether we do just UVA, UVB, UVC, or we add photobiomodulation, we are stimulating the cells themselves to respond. And of course, the ozone is killing off some of the bacteria and phages and that we may or may not need in an inflammation. But now that I work a lot with microbiome, I don't want to kill all of it off. I want to kill what I need off in one location, and the rest of the body, I want it to flourish, because that's what protects the body. So we're using ear insufflations with the ears, and I'll show you some pictures, which goes through the tympanic membrane, picking up in the ears, as well as so for infections, and this is something pet parents and people can do at home. And you can get ozone into the body through the blood vessels in the tympanic membrane. And it also goes into the head, and bagging the body with ozone if you have infections or wounds or anything like that. So here's a cat. This is Blossom, and Blossom had vestibular issues. But Blossom's backstory is, this is Blossom about 5-6 years after I started taking care of her. She came to me at 16 and a half, almost 17, in complete kidney failure, and was told, just get everything in order. She's going to be euthanized. And the owners, I encouraged them to buy an ozone generator, and they were doing ozone plus the herbs and the homeopathic and the acupuncture that I do for kidney failure. And at this picture, she was 23 years old. She was 24 when I put her down. And, but she got all different types of ozone. But I truly believe, I don't think she would have lived without the ozone helping her with her kidneys. Here's another dog that had a brain tumor that we were using it for the brain tumor. and then you can use it for ear infections and everything else. So, you can treat your own pets and yourself, but treating others, you may get in trouble because you cannot practice veterinary medicine without a license and you can't treat other people. So if you're going to get one, you do it for yourself. You do it for your animals. Having this tool in your home will be able to continue vet care at home. Ask your vet on how you continue to give ozone in dosages and amount. Generally speaking, I start with about 100 cc's of mixed ozone delivery for a 35-pound dog. So if I do ear insufflation, I'll do a certain amount, a certain time. If I do rectal insufflation with sub-Q ozone, then I sort of have these depending on what the issue is with the dog. So about 3 cc's per pound of body. So a 10-pound cat would start out with like 30 cc's. So if I did 20 cc's sub-Q and 10 cc's rectal, that would be 30 cc's of treatment. So that's sort of a simple way to look at it. When you use ozone in different delivery, add up the cc volume so that you're staying within that range. So here's a cat that had chronic sinusitis that the owners had an ozone generator and developed this just using a regular face mask and putting it through olive oil. And the cat actually enjoyed it, and it got rid of the sinus infection. So this was a creative slide by someone who sent it in to me. Flushing the eyes. So I have it obviously hooked up to the IV saline maker, which Jonathan makes as well, and hook it up and just squirt the fresh ozone right into the corneal ulcer and the conjunctival infections. Using it as a subcutaneous saline, so under wounds and under hot spots and in inflammations and even cancer, to be giving it under the skin. So here we are delivering it under the skin, and then we wash that surface also with a lot of ozone, disinfecting that biofilm or removing the biofilm, disinfecting, but at the same time, giving oxygen to the healthy tissue that's there. So that heals a lot faster. So this is a cat that I did in 2006, which was a long time when when I had been doing ozone at that point for about 3 years, 2.5 years, but it was a severe degloving wound from a fan belt. And they told the owner at Angel to amputate the leg. They did not think they could save the leg. It was badly, badly injured, but they did a great job cleaning all the oil and the sand and everything that was on that belt out of the wound. And we did ozone and acupuncture and had it chiropractically adjusted, but bagged that cat's leg in ozone and did ozone sub-Q. And within a week, it had healed. And I saw the cat several weeks. This is actually after it had healed. I should have taken pictures before, but it healed. It all healed, which was amazing. And the cat had its leg for 7 years and it got cancer, but lived to be an old cat. But just in the recent literature, this is stuff from during in 2020 that the veterinarians during the fires that were in Brazil and in the rainforest and stuff, these animals were getting severe burns. And in Brazil, just FYI, as of July 2023, the president of the Brazil has approved ozone not only for veterinary care, dental care, and medical care, and for treating COVID. And so now the rain is lifted off. The country has accepted it as a form to control infections, viral, bacterial, and it stimulates stem cells. So it's a really wonderful opportunity to help humans and animals. This is a serious FIV positive lesion. The cat was positive for FIV. Cat is really difficult to treat. It was very inflamed underneath of it, and we supported this cat with. I diagnosed using Dr. Pleckner's work, but it had this immune endocrine imbalance. It's still alive, and this picture was taken, I want to say, like 4 or 5 years ago. But it's 2017, and the cat is still with us, right? So, and so we cleaned it up, washed it up, did ozone and UVBI underneath of it. Kept doing that and having the owner put ozone oil, give sub-Q at home, and you can see this whole thing healed up. And so having the ozone as a backup at home, she was not able to treat him at home. This was done in the hospital, but most animals you can treat at home. This is a really terrible ear infection. This dog had its ear partially removed and it was a adoption, and the whole ear was just completely like the cauliflower coming out of the ear. So the recommendation was to remove the whole ear canal. And with treatment and ozone and ear insufflation and all that, we were able to get that to go back to normal. The dog has normal ears now, which is really amazing. So adding ozone to aquapuncture or acupuncture, adding, I think when you put sub-Q ozone into the fascial layers and then you put your acupuncture or your laser through it, you're going to be adding that extra oxygen into the tissue. Ozone gas is done in Brazil with the acupuncture points a lot. That's a lot of the way that they inject ozone is right into acupuncture points. I do some of that, but I do mostly ozonated saline and then use B12 coming through that. I think by adding more oxygen, you're increasing the chi of the body, and you're giving more oxygen to the mitochondria and supporting it. So using ozone with saline, and this is a dog who had a disc and was paralyzed, or not paralyzed, but partially paralyzed. And we did the ozone and the acupuncture, and the dog was walking after the treatment. So we're doing the sub-Q ozone on the left, and then doing the acupuncture on the right, and bringing down the inflammation of the back. So if you have chiropractic available to you, bringing the ozone into the inflamed area and then having them adjusted, I think it helps bring the oxygen to make things move much more easily. The chiropractor I uses applied kinesiology, and it's really interesting because I've taken the chiropractic course, but I'm nowhere as good as Dr. Chong and Dr. Kraushaw, who I send them to. But I find that it changes what I feel on the animal after I put the ozone on. So but they're so good, they can discount that and keep moving forward. So I do it before the chiropractic and then send them to them, and then they adjust it. So a good sequence is ozone, chiro, and then acupuncture. Because if you can get them aligned properly and then do the acupuncture, I think you're going to get a better bang with your acupuncture than just doing acupuncture. I think doing the three together is a really wonderful thing. With homeopathy, those of you that do homeopathy, I think it increases the vital force as it's giving more oxygen to the body. People that are classical homeopaths, and I consider myself one, but if I can get more oxygen utilization in the body because the body is just so weak, why not do that and then ask the remedy to do a better job? And I don't think it distorts the vital force, because the 1/10 of your body is mitochondria. And if you're increasing the mitochondria to help your body, why wouldn't you want all them helping you? And with 90,000 chemicals in the body, to have a natural occurring oxygen thing that can be done seems a very positive thing. With all integrative therapies and conventional therapies, laser, PMF, microcurrent, Rife, Sanawave, and conventional treatments, ozone is going to potentiate it and make it more successful. So physical therapy, there's better oxygen utilization. So it's like exercise and an injection. So you're giving a lot of oxygen. When an animal gets to exercise, that's more circulation into the muscles. And if you do ozone over that area and then you ask them to get muscle, you're going to get more oxygen into the tissue. So I use it in surgery, and it's such an added adjunct. I don't use antibiotics. I mean, I had my cat that was on my lap. I don't think you guys can see me, but she was on my lap when I started. She, about 2.5 months ago or 2 months ago, she got really sick. Long story, I thought she might have had pancreatitis, and she just had disappeared for like 3 days in my house. I couldn't find her. I was stressed out. And she came up, and I took blood on her, but it happened at 11:30 at night. I found her. So immediately got my ozone. She's back on my lap now, but you guys can't see her. But immediately gave her ozone sub-Q, took her to the clinic, did blood work, and it's a great case that she ended up with a pyometra. I took a culture of her vaginal discharge, but her numbers on the white cells came up normal. And so it came up pancreatitis as the lab tests. Anyway, treated her for pancreatitis with ozone, which included ozone, rectal ozone, and a fecal transplant, which is how I treat pancreatitis. And then about 5 days later, it was 4th of July, and I decided to spay her because I pretty sure she had a pyometra as well. And we cultured a vulva, waited for the culture, which was 6 days. It was resistant to like most of the antibiotics, except the most strong antibiotics. And this is one of my fecal donors. She's 30 years from a cattery that never has had drugs either. So I'm not going to give her antibiotics when I don't even know what antibiotic to use. Got the antibiotic and saw the resistance. The ones that I would have chosen would have been completely wrong. So, but she was doing better. So I cultured the uterus when we took it out because it looked like 2 kielbasa's filled with mayonnaise. Cultured that. She was doing better. Her incision got irritated. I injected ozone gas. During the surgery, I lavaged her abdomen with ozonated saline and gave her UVBI with the hemolumin. So we did the photobiomodulation as well. And she completely recovered, never, ever getting any antibiotics, only getting homeopathy, ozone, UVBI, fecal transplant, some acupuncture, and supportive herbs. So we need to be looking at these things because I do not know anyone who would have not put this dog on, the cat rather, on antibiotics. So, but you can get rid of the bacteria in the abdomen by lavaging it with ozonated saline. So that's what I did. And, but here's some other pictures of using it in surgery. So we have it in our surgery suite. I use it, like for intestinal anastomosis or intestinal foreign bodies. I'll have an area of the intestine that looks pretty bad. And I put ozone on it and it looks normal. So I don't have to take it off, out. Cleaning the whole, when you open it up and you take the foreign body out and you have the intestines getting possibly contaminated at all, to be flushing and cleaning and getting rid of all the bacteria that's there, lavaging the whole abdomen. And so in a bladder, it reduces the bacterial infection, reduces the viral inflammation that's in the bladder. And bladders are not sterile. They're full of stuff. And we cannot culture a bladder now. There's no test that it can really do a good job culturing the bladder, urinary tract. So this is we're just filling up the bladder here with ozonated saline.
So the bladder's going to fill up with urine.
With ozonated saline, and it's going to change the color of the bladder because it's trying to, it's oxygenating it. So we're just checking the incision of the cystotomy, but as I do it, the bladder starts to get more pink versus red and tight. Yeah. But you can see it's really lightening up. And after the second one, it really lightened up. And then lavaging the abdomen. This was a pyometra on a dog that ruptured 72 hours prior and should have been euthanized. And we saved it using ozone, UVBI, and intraperitoneal ozone injections. But it's an amazing tool. And we don't have time to go through the whole video, but I have it. It's on my website, the whole stuff. But using the dentistry, it should be required in dentistry, cleaning teeth, and because we have to remove the biofilm of the mouth. Putting animals on antibiotics post-dental is, to me, wrong. Nobody's cultured the mouth. They don't have no idea. Each pocket, each area, each aspect of the tongue and the mouth and the gums have different bacteria, and they're not cultured out. And so getting an animal on an antibiotic post-dental, to me, is wrong because you're going to cause dysbiosis in the body. So you want to flush the gingival infections, reduce the inflammation of the mouth before and after. So we use it. I have clients making their own ozone, cleaning their dog's teeth using ozonated oil. We inject it into the roots, into the sockets. It prevents pain. I don't need antibiotics. I haven't used antibiotics in dentistry for almost 30 years. And having a tool like ozone even totally potentiated it even more. So why would I put an animal on antibiotics that causes dysbiosis and causes them to have GI problems and yeast infections? And the other point is that, when you use a Cavitron, you're aerosoling that bacteria all over the building. It's spraying stuff, right? If you put the ozone in it, you're first of all cleaning your line, getting rid of the biofilm that's in the line, as well as disinfecting the mouth so that whatever liquid goes into the air is not full of dog bacteria that is not healthy for everybody to be breathing in. We also have hyperbaric oxygen. There's different types of chambers that potentiates the ozone too. Direct IV in animals, it's controversial. In horses, it's a pretty much accepted way to do it. I've done a little bit in dogs. I usually don't do direct IV at all in animals, like because I use a lot of ozonated saline and I do major autohemotherapy. So I'm not recommending you do that, but it's you may hear about it, and I have done it on animals, but I prefer to use major autohemotherapy. So here's a diagram of ozone generator, looking at ozone as a how we deliver it. We percolate it into the saline, and then we can distribute it all over the place. You want to always use pure surgical oxygen. Some people are doing oxygen extractors. If you're doing anything when it comes to directly in the blood, you want to use a pure oxygen. So you can get high-end oxygen from a welding to do the sub-Q fluids, but not intravenous. I think you really need to be doing the pure surgical oxygen. But bagging and ear insufflation and rectal insufflation all could be done with an industrial oxygen supply. And fecal transplants is a big thing. And I think this is sort of one of my missions too, is that ozone will put its mark because it helps with the fecal transplants. And people are doing fecal transplants now. When I started doing them 12 years ago, literally I thought I was full of crap. And now I'm very proud that I'm full of crap. But to know that the biofilm can be removed by doing ozone gas and not putting these animals on more antibiotics to get rid of the biofilm makes it so much easier to do a fecal transplant. We do it standing, just like this picture. We put ozone gas where the syringe is. We try to blow it put the catheter as deep as we can to try to get into the transverse colon. And then we put our donor microbiome in there. And I think it's very important to have the quality microbiome. And like I said, we've protected ours for 30 years, 6 generations, and have still protecting them. So we also, we put the ozone in rectally. We do about at 35 to 55 micrograms per milliliter. We hold the tail down for 2 or 3 minutes, let the dog wait for a little bit, and then take it out to go defecate. And then we give them subcutaneous ozonated saline. We give them vitamin shots B and C and vitamin A and D, because there's blood levels of vitamin B that we need. So I might as well just give it to them. And there's levels of vitamin D that we need. So I just give it to them. And then we put the slurry of the feces right back into that area. So we want to disrupt that biofilm. And this is what biofilm looks like. It's the slime in your mouth when you wake up in the morning. It interferes with normal exchange of things that should happen on the skin, in the mouth, and the different cavities. So if you have an animal that's been on antibiotics, you could have a completely abnormal biofilm that's preventing your dog from healing. And what's really cool is ozone has been noted to stimulate stem cells, and ozone works with the mitochondria. So on this diagram, if you look at the bottom of the diagram, there's the ones that are sort of green at the bottom. There's blue cells. Then it's at the base of that one on the left, there's green cells. Those are the stem cells of the columnar cells of the colon. So when you put ozone gas and dilate the colon, some of that gas is going to go down into those crypts, and they're going to throw out the bacteria and phages that are all sitting on that surface. But I also think it has an opportunity to stimulate the stem cells of the columnar cells, which are the colon cells that are really important on having a balanced gut. And as well as it goes through and goes into the caudal rectal vein, into the mesenteric vein, into the liver, which helps treat liver. And that's why treating the liver with ozone is a wonderful way to support the liver. So we do the fecal capsules. We have double wall, triple wall capsules. There's so many ways now for you to get fecal transplants now, we're really proud of it, because ours are considered number 1 in the world. So you can give orally. You can put poop in and give it orally, and wrap it up and do that. And I think giving supportive ozone for the whole treatment is wonderful. And then we do a nutraceutical support. This is our MBRT center down below, and we've got cryo freezers and are producing these microbiome nuggets and slurries, and then we're also having them shipped to 2 other locations, which I'll tell you about, that you guys can get around the country. So, but we're trying to have high quality control. We are freeze drying our microbiome as well. And this is our freeze dryer here. And you can also get our dog's microbiome from Legacy Biome, which is based in Canada, and they ship internationally and nationally. And Animal Biome, which is started up about 5 years after we did, and they are the testing center to test the microbiome. But you have to ask for the antibiotic-free raw-fed dogs that are Dr. Roman's. Otherwise, their regular donors have not been on antibiotics for a year, and that's I think you need more than that to get a really good donor, but that's what you can get from Animal Biome. We are now freeze drying our own dog stuff into freeze drying capsules that we are selling, and right now we're really selling to vets right now. And the other ones, Legacy Biome, you can buy from them directly, and you don't need to be a veterinarian. But these freeze dried capsules we sell directly to our clients and to other veterinarians. And then this is just, you can go on this QR code and list, see the things that we're doing with this microbiome stuff. But it's wonderful for autoimmune disease, for cancer, for chronic dermatitis, allergies. You got to do it for allergies. I am publishing a case now of a dog that was on Apoquil for 2 years, antibiotics 10 times, had 21 vaccines, was 4 years old, was a bald newfie, and had a constant eye discharge, matted eyes, matted ears, had tail like an armadillo and skin like an elephant. And we did a fecal transplant and ozone and UVBI and minor autohemotherapy. And in 6 months, the dog hauled its hair back. 6 months later, the dog, you would never even recognize the dog. Its tail was like 2 feet and just swished over its back. And the dog actually had too much hair because she would have it groomed and it was ready for a dog show. It was amazing that would switch over so quickly. So thank you for letting us explore a lot of this, for your time and share some cases. And, I want to encourage you to look at microbiome and how it can help your pet, and increasing the quality of the ozone and how it can help your pet. Increasing the quality of the microbiome diversity is a really big piece of success, I feel, of using the ozone and then adding that component. The use of ozone for infection and inflammation is critical to antibiotic resistance and helps with fungal and viral infections. And, you can get, like I said, you can get the Touch of Life microbiome from mbrt.life, mashvet.com, legacybiome.com, and animalbiome.com. And make sure you ask for the raw-fed Dr. Roman's dogs. And we want data. So any of you that are doing ozone and, have had successes, we need to share these cases and let other pet owners know, let other veterinarians know how you have done this. And there are going to be different courses that are going to be taught around the country by different doctors. And we're all trying to have a group that can sort of keep it all copacetic and working together and make everybody learn more so that they can help their pets and the doctors can help them as well.
Okay, so the first one is actually a little off topic, but I think you mentioned it at the beginning, which is ozonating vegetables. How long? How much water to vegetable weight? Do you have it? Do you do that? Are you?
I did that at the beginning of COVID. We
Yeah.
we were using our generator, and then when we went to the SOP Med meeting, you had that little ozonator that used outside air to ozonate, which was not surgical oxygen. So there are cheaper ozone generators that make ozone through room air, which is not very, I would not use that for any medical treatment, but you could make ozonated water with that, and that would disinfect your vegetables. But in the beginning, I didn't have that, and I was using my regular, surgical oxygen, bubbling the water, making a big tub of ozonated water, and basically dipping all the vegetables, at the end, throwing all the vegetables in there and letting them do that. And very, very strict on that in the beginning of COVID, because we just didn't know what kind of fomite potential was going to happen from the food sources that we got, right? So is it possible to get off the slides and then talk to people? I feel like I'm looking at.
Yeah, you can go ahead and minimize those or cancel those.
Okay, end of slideshow, exit. Okay.
Yeah.
Okay, are we back to you? Do you see? I don't see you. Do you see me?
I am here. You're probably behind something.
Okay. Oh, there you are. Okay, let me shut this off. Okay. Oh, that's something else. 1 second. That's not what I want.
Yeah, just don't leave us. That's all.
Great. Where did I go?
We can see you.
You can, okay. Oh, here you are. Okay, so let me just minimize this. I don't want it to keep moving. Okay.
And the next question was about bagging.
Mhm.
Um, how long, based on the diagnosis,
Okay. So if let's say
exam?
an infection in the foot and you want to bag it, there's several ways you can bag it. One is you can just take gas and bag it. The one that I think is even better is to ozonate saline or water, put the whole paw in a plastic bag and use the water and the saline to really get the foot really clean. Dump that, put more water in, and then put your ozone gas into the water and bubble it around your foot. And then you're really getting a nice clean, you're going to come out with a really clean foot. Bagging with gas alone and using a leg limb bagging, you can bag the entire animal. In the beginning, that's what I was doing in many of the cases, and I using Tyvek was what I was told to use. So I made what was equivalent to a pillowcase with a drawstring, and the inside has the lettering for Tyvek, so that you have it with a lettering for the Tyvek. And Tyvek is the white wrap that they wrap houses with that helps protect the from the elements. And so I would bag the whole animal in that, and I would put them in a cotton, like a flannel cotton pillowcase, so they wouldn't leak any fluid or anything else. I could use the thing again, right, and just wash the pillowcase.
Yeah, so it's typically about 10 minutes
Oh, yes,
maybe
time.
per treatment,
That's
and
how long the animals sit there. So
yeah,
10 minutes, 20 minutes. I probably wouldn't go
once a week
I
ish.
do it if it's a bad infection. I do it every day or twice a day.
Yeah, if you can.
Yeah.
Yep. Okay.
Yeah. So this is
What?
Bliss. This is the cat that had the.
That's awesome. What about ozone for interdigital cysts?
Yep.
What
Bag,
route of administration?
bagging the foot would be great. Ozone oil on it would be great. Giving systemic ozone is good. I mean, those are just very, there's inflammation in the body when those things happen. And if you can, it's a systemic thing, but it's an irritation at that location that's causing
Mm,
that cyst to occur.
okay. So Keisha says that she's giving sub-Q saline and rectal insufflation to her dog for transitional cell carcinoma, early stage kidney disease. What concentration treatment frequency do you suggest?
Well, when I do the saline, I bubble it high, but it's supposed to only saturate at you know at at sea level and at room temperature, which is like 75 to about 37 micrograms per milliliter. So that's what I always use. If you live obviously in the mountains, it might be different. Getting a machine to figure out how much percentage of ozone you have in it might be in it, a piece that you can look at. Dr. Dennis Maholka, who's a dentist in Idaho, he has done a lot of studies with concentrations and temperatures of ozone in different fluids. But yeah, I mean, I usually, but when I bubble my ozone, I fill up my cylinder and I run it for 30 minutes because that's what Lyle Hassel told me to do. And I still do that. I know everybody does less, but I always do it for 30 minutes because I'm opening up the glass and putting the ozone in, and it's sterile, but it's being poured through the air, and just trying to cover myself to make sure it's done, as long as I need to.
Yeah. So how often would you say daily on a rectal insufflation for something like this?
For the digital cyst, yeah, you could do it.
No, for the transitional cell carcinoma that.
Okay, transitional cell carcinoma. Doing yes every day. You're going to go over the bladder. Dr. Adriana Capero from Brazil. I'm saying his last name wrong. I went to Brazil and watched him in Sao Paulo do bladder flushes on a little dog with transitional cell carcinoma, a little Yorkshire Terrier. And he had been doing it for 2 years, I think. So he would catheterize the dog, flush the bladder with ozonated saline, and the dogs. And I've had transitional cell carcinoma one go for 5.5 years, and was getting ozone and homeopathics, a lot of energy work with Tong Ren and meditation and all that. And I went 5 years and with the transitional cell carcinoma. So I don't, again, doing the ozone was a big piece of it, but that we did not catheterize her because it was a female. She was done only by sub-Q and rectal.
Great. So we are actually, I'm really sorry, guys, but we are out of time. I know there's a number of other questions. Hopefully you'll be able to ask those in the panel discussion we're going to have at the end. I'm sorry. We got to move on though. Thank you, Dr. Roman, for being with us.
You're welcome, guys.